I'm Lindsey Smith, welcoming you to Raise the Line from Elsevier, an ongoing exploration about how to improve health and healthcare. At a time of a growing shortage of physicians and nurses, physician associates are becoming increasingly central to how the healthcare system works. But laws governing their practice in many states have not kept pace with these new realities. We're going to learn more about that issue and other dynamics in the PA profession today with Dr. Jennife Kolb, the Chief Medical Officer and Senior Vice President of Clinical Affairs at the American Academy of Physician Associates and Executive Director of the Physician Associate Foundation. Dr. Kolb has been a clinician, patient advocate, and policy change agent for more than 23 years, holding leadership roles at both the state and national levels. Before her current role, Dr. Kolb spent much of her career at Rush University System for Health in Chicago, where she served as an assistant professor, a vascular surgery PA, and director of advanced practice. Thanks so much for joining us today, Dr. Kolb.
Thank you for having me.
So let's start with learning more about you as a person first, and then let's get into what first got you interested in medicine.
Sure. So I'm a longtime PA. I have practiced 23 years in vascular surgery at a large academic in Chicago. I consider myself a recovered director of advanced practice, where I was responsible for all of the APRNs and the PAs in the hospital system. But I've been involved in healthcare policy and advocacy and modernization for pretty much my entire career, and now get to do it on the national level. I have a lot of different hats. I'm responsible for all of our health equity work here in the organization, all of our partnerships, our foundation and our philanthropic work, and really all things clinical here at the Academy. So get to do my day job. But how did I get into medicine? Well, my mom was a nurse. And so I think I grew up from the medical point of view. And I used to go with her to the hospital at night. She worked the night shift. And so I always wanted to do more from that. So always had an interest in science. And really my trajectory through college was very much science-based and into human anatomy and physiology and on to PA school.
Thanks so much for giving us that background on your personal path. And there's a lot that I want to unpack there that you mentioned. But for now, let's stay with the PA profession. When you were starting out, did you aspire to hold management roles, or how did you get into that?
No, I talk about this a lot, at how my path has taken so many twists and turns over many years. I was going to be this practicing clinician and ran into several bumps along the way. And I think my first sort of jump into leadership was I was taking care of a patient postoperatively, and I was removing their sutures. And I was told by a nurse in the hospital system that I was practicing outside my scope, and she was going to report me to the medical staff. And I said, I put these sutures in so I can take them out. And do you know what PAs do? Hence began my journey into show me the policy. And where did you get this from? And what does state law say? What does the hospital policy say? And so, I was in an organization where I was the first PA in vascular surgery. They weren't really familiar with PA practice in the hospital system. There was only about 25 of us, and majority of them worked in a private orthopedic practice. And so I became sort of a de facto go-to person for all things PA. And then my career just took step after step after step. So from working as a faculty and developing the PA program to then stepping in an administrative role and an executive role as I was asked, because we went from 20 PAs to hundreds of PAs and APRNs in the hospital system over many years. And I joke that I was, we called them advanced practice providers where I worked, but I was an APP before APPs were cool. And so I have the benefit of helping establish strategic operations in the hospital system. And I have since moved on from that large academic, but truly was an adventure, and now has led me into this executive leadership position at the national level. And I could have never imagined that I'd be here when I started out.
It's interesting to hear how that unfolded with that specific interaction with that nurse. So thank you for sharing that. And I know we've heard on the podcast from many clinicians about their relationship to leadership changes as their career continues to progress. The PA profession is 60 years old and has grown to over 200,000 practitioners in the US. I know particularly at Osmosis, we've also seen a ton of growth there. But for our listeners who may not have a clear picture of what a PA does and where PAs practice, can you give us a sense of the profession today?
The PA profession continues to grow. Now we're well over 200,000 and growing, probably about a rate of between 20 and 30% each year. So it's a fast growing profession. And the bottom line is PAs practice medicine in every specialty and setting that exists in healthcare today. Anything from emergency medicine to family practice to vascular surgery like I do. PAs are everywhere, and they're practice owners, they're executives, they're clinicians, they're researchers, they're public health experts. And, the beauty of being a PA now is most of the PAs that are up and coming and graduating, which is the next generation of my Gen Zers, I call them, and soon my Gen Alphas, but they come with such a different spirit and different background in approach to healthcare. Many have their master's degrees, many are doctorate degrees, many have worked in public health sectors. It is very demanding and difficult to get into PA school than it was when I first started many, many years ago. But it is a growing profession and one that is highly sought after.
PAs are such a vital part of the healthcare system, and you're exactly right. We're seeing them absolutely everywhere, which is amazing. So as the profession has grown and changed, you've been deeply involved in practice modernization, the effort to update the laws governing what PAs can do. What's outdated about the current framework, and what would you like to see in the new one?
Well, unfortunately for us in the United States, most of healthcare in every state is outdated. These are laws and policies and regulations that have been on the books since the 1960s and the 1970s. And if you remember, if you were around back then, medicine was practiced very differently, right, in this country. And physicians owned majority of the practices that existed. They practiced very independently. They hired their own staff. And that was how medicine was delivered. And since, and especially in the 2000s, we've seen this rapid growth and combining of healthcare systems, sort of this corporate approach to medicine, where now it is much more team-based, highly collaborative, highly sophisticated care coordination across multiple state lines, multiple systems, multiple hospitals. Most physicians and PAs and APRNs are employed by larger systems or the organization now, whereas before it was the private practice. So we don't move very quickly at updating laws and policy in either the states or at the federal level. And so a lot of what's on the books is very outdated, antiquated, old language, very restrictive language that impedes access to care and really does not enhance patient outcomes. It continues to worsen health disparities. And we, as PAs, have done a lot of work to help folks understand how highly sophisticated and demanding our education is and our continuing medical education, but really employ and ask the states to update their state law to modernize what modern medicine looks like, which is really PAs practicing autonomously in every specialty and setting. They really have the skill set and the ability to do so. And what we've really focused on is modernizing healthcare so patients have better outcomes and better access.
That's a really great overview about the outdated and current framework. We're going to get to health equity and ultimately health outcomes in just a little bit here. But for now, let's talk about a hot topic. Several states have recently moved to change the title from physician assistant to physician associate. Can you tell us why the title matters and what does it look like on the ground level?
We actually started as physician associates, and we have many schools that have been physician associate all along since the profession was established in the late 1960s. We conducted a study at the APA, oh my gosh, probably 7-10 years ago now, to really garner public opinion as well as opinion from our employers, our physician colleagues, and others about Does the name really reflect what PAs do? Patients are often confused when they see a physician assistant. They think they are assisting, and PAs do not do any assisting whatsoever when it comes to medicine. And so, associate was a better representation of who we are, how we practice, and the autonomous decision making that we make on a daily basis. For example, I've been a practicing PA for 23 years. I used to cover the ICU when I was a young PA in the middle of the night by myself. There's not a physician in sight. There was nobody there doing procedures. There was nobody there handling emergencies. It was me. And so this misnomer of assistant versus associate is really just righting the wrong after all these years and ensuring that PAs are represented for the work that they do and that it's not confusing to patients. We are still PA. So it's really important that we move from that assistant to associate title. And I'll give a little anecdote. When I was first a PA, I actually didn't think this was that big a deal. Who cares about a title? It's not that big a deal. And one of my close colleagues and close friends, he used to scold me all the time and say, it really is a big deal. It's a big deal to patients and it's a big deal to the public. And it took me several years in my career, especially on the advocacy front and all of the work that I do from a legislative standpoint, to understand why it's so important. How we talk about ourselves, how we represent ourselves, how we show up for our patients is essential. They want to build that trust as a patient, and patients have better outcomes when they work with somebody that they trust, they know is trained and educated to help them take care of their health and really become the best person that they can be.
That makes total sense. And we do know titles do play such a meaningful role both inside and outside the healthcare system. Let's switch gears and talk about AAPA. Can you tell us what it is and what it does?
Well, the AAPA is the sole national professional society for all PAs across the United States. So we are the organization that represents them. We are the organization that is in every state and at the federal level, really driving change in those states. We have chapters in every state. We have specialty organizations. And really, the AAPA sets all of the policy for the PA profession as they practice, right? We work with the federal government when they're updating laws, rules, regulations. We work closely with Centers for Medicaid and Medicare. We work closely with HHS, the FDA. We're part of many committees and coalitions that exist across the United States, really to ensure that the PA voice is always represented at the table. And that is the fundamental purpose of the Academy. This is why it's so important that PAs are members of the Academy, they're members of their state academy, because as a wise advocacy leader once said, if you're not at the table, you're on the menu. And so with 200,000 PAs across the US and almost a quarter of the provider workforce in the United States, we need to make sure that PAs are heard and represented and at the table.
So just to play that back a little bit, AAPA is supporting physician associates in their careers, advocating for the profession, and working to improve patient health and access to care through PA practice. Is that fair?
Oh, yes. I mean, we could use 5 podcasts to go over the laundry list of all the things, anything from starting your career, all of the career resources across your entire trajectory, healthcare policy, advocacy, education, continuing education. We are the main source of continuing education for PAs across the United States, as well as we keep our members up to date on all the change that's going right. Healthcare is extremely complex. And so one of our big jobs is really communicating with members, as well as conducting research in the profession. We have a very robust research team and research department, which I am also in charge of, that really is looking at PA practice across the US, the PA workforce, the economic impact, and the education and patient outcomes tied to those PAs as they practice. So there's a lot that the Academy does as the sole proprietor of the profession and representation of the profession, but it's good work.
Absolutely. And we will be sure to share the AAPA links in our show notes for our listeners to check out. I want to come back to something you said about driving changes. What are the main changes AAPA is advocating for at the federal and state levels this year?
So modernization is our biggest, right? If you look at the states are so disjointed in who's where, right? So how you practice in Maine as a PA or Iowa is very different than Texas or Florida. And so a lot of our PA modernization work has been not only to focus on removing the legal tether to physicians in states so that we can improve patient access and outcomes, but also working on title change, and then updating any outdated laws that restrict PAs in any way, whether it's ratio requirements, prescribing requirements, access to needed services. I'll give you a common example, and we've been working on this at the federal level for a long time, but diabetic shoes. And so the diabetic shoe legislation has been readmitted into the federal level it has to be 10 years now. And really what this does is it authorizes PAs and APRNs to write prescriptions for special shoes for those with diabetes. Now, I can diagnose someone with diabetes. I can change their insulin doses. I can admit them to the hospital and put them on drips if they need to. I can manage all of the medications and care of a diabetic patient, except I cannot write for special therapeutic shoes that diabetic patients often need. So this is where that conundrum in healthcare goes on, right? It doesn't match what we're doing. And so we have a lot of workers' comp bills at the federal level. We are doing a lot with CMS and modernizing those changes for Medicare and Medicaid. And then at the state level, it really is about removing that legal tether to physicians, title change, ensuring that they are able to fully bill and submit claims in their name so their work is not hidden, which often is how our system is set up, as well as the compact and compact portability as we see telemedicine that has expanded since the pandemic, as well as PAs who work on state lines, right on state lines. It's important that PAs have the ability to deliver care where it's needed for their patients, as well as do the work that they set out to do for themselves. So lots and lots of moving parts. We have a very busy advocacy team doing a lot.
Interesting. And thank you so much for sharing the diabetes shoe story. I think a lot of the priorities you mentioned reflect a lot of different pressures that we see in the healthcare system today. Another theme that seems to cut across much of this work is equity and access. I know health equity is a central pillar of your work and AAPA's strategic direction. Where do you think PAs have the greatest opportunity to advance access for underserved communities? And what is standing in the way today?
Well, if you just look at the data and statistics, right, there's a lot of unfortunate realities that we face. If you look at the data from HRSA, over 96 million patients lack adequate access to primary care across the U.S. Almost 30 million are unable to even afford insurance or access to that care. We have rising rates of chronic conditions, so anything diabetes, hypertension, as well as Alzheimer's disease, these continue to rise. And the age of our population continues to rise. We will hit over 80 million people over the age of 65 by 2040. And who are the highest consumers of healthcare? Those over the age of 65. On top of all that, we continue to see tremendous healthcare disparities to not only different populations, right, and those that are underserved and underrepresented, but also in rural areas. So we've had a lot of focus on how rural access is really in crisis, not only for primary care, but also specialty care. And what we have is this untapped, army of 200,000 PAs that really could step up and drive some change in the healthcare system here. And for us at the Academy, it's really important that, one, we're building a sustainable healthcare workforce pipeline and a diverse healthcare workforce pipeline. We know from evidence that patients do better when they are seen by healthcare providers from their community that look like them, talk like them, understand them. It is that is a fact. And so for us, it's really important to take and ensure that there's representation in medicine for the communities that we serve. So that's one piece. But then there's that piece of access, right? If you took where I'm from in inner city Chicago, the outcomes of patients on the west side and the south side of Chicago are drastically different from those in central or northern Chicago. There is tremendous disparities among race and ethnicity around poverty and low income. And the age, and I don't recall the study off the top of my head, but just a few years ago, there was a study that showed the median age of living on the west side of Chicago was about, I want to say it was 75. And in downtown Chicago, it was like 85. So 10 years different depending on your zip code and where you live. So for us as PAs, it's really, we focus a lot of our efforts on why PAs are so important, and really that 96 million gap of access is why PAs are so important. And it's going to take all of us. This isn't a competition and someone's better than so-and-so. This really is, we do not have enough physicians, PAs, or APRNs in this country to serve all the patients that need care. So this is why we do that work that we do. We have to get innovative. We have to create care delivery systems that are going to improve patient outcomes.
Thank you for sharing that. So for someone that's listening who wants to be part of the change, where do you recommend they start?
Well, I think you start at aapa.org, right? Inform yourself. If you're interested in becoming a PA, we have tremendous resources for pre-PAs and those that are looking at becoming a PA. We often meet with young students, so those in third grade, fourth grade, fifth grade, all the way through college, to help them understand that they really can choose this path about becoming a PA. Your destiny is not defined. What does it take? What is it like to be a PA? And so we're meeting with more and more young people, and there's a lot of resources on the AAPA website that can help young people choose their path, right? If you want to become a PA, here's all the things that you can do. Here's how you can get interested. Here's where you start, and a lot of those careers. And then for those that are new in the PA profession and just trying to figure out this thing called medicine as they get started in their career, really use AAPA in that early career part. They have a lot of resources, not only about practice, but about wellness and mental health wellness and how to take care of yourself. This is an incredibly complex time. We have a lot going on externally outside where just our community and where we work. And it's really important that you take care of yourself as you move along in your PA care journeys. And then if you're an old dinosaur like me, we have lots and lots of things on our website, from advocacy to continuing education to policy to career resources. Do you want to become an executive? What am I doing? Where am I going? And how do I have a larger voice, right? It doesn't always mean you have to meet with your senator. There's lots of ways to share your voice and your perspective without actually, marching down to Capitol Hill and meeting with policymakers. So we have lots of different options and good resources for folks.
The healthcare shortage is a big challenge today, and we need more great healthcare professionals, including PAs. So definitely check out the AAPA website. It seems like there's something there for everyone. Let's talk about our audience. So we have many students and early career health professionals. What is your advice to them about meeting the challenges of this moment and building a meaningful career in medicine?
The one thing I always share with PAs, and I want them to know, because I think a lot of PAs come out of school thinking they need to wait for somebody to tell them to do something, or they need to ask permission. And I want PAs to understand that they can drive the change themselves. One person, one community at a time. You don't need permission. You are experts in medicine. And I want PAs to know that. And I want them to start really taking that knowledge, that skill set, and using it in their communities, whether it's using their voice, right, to change policy or legislation in their own workplace or even in the state that they live in their community that they work in. But they actually have the skill set through their education and how rigorous it is. I was just telling somebody the other day what it was like. Somebody had asked me about going to PA school, and they said, what was PA school like for you? And I said, I would never do it again. And they said, what? Why would you say that? It was some of the hardest 2.5 years of my life. And, At the time, I just saw it as extremely difficult, right? It's 2.5 intensive years. It's a doctorate level preparation, the amount of hours, the amount of training. And what I didn't realize was that it was preparing me for what I was about to face. It isn't like it is in the storybooks, right? I was working in downtown Chicago at Cook County Hospital, and then I was working at Mount Sinai Trauma Center on the weekends. And I was going from vascular surgery, patients with rupturing aneurysms and gangrenous legs, to gunshot wounds that were coming in. And it was me and 2 physicians handling 3 gunshot wounds at the same time. And I would not have been prepared for that unless I had gone through PA education in the way that I had done. So, to go back to your question, your career goes in different ways than you never expected. Obviously, here I am, a CMO, could have never called this in a million years that I'd be here. But you just have to buckle up and enjoy the ride. Be prepared. You may be the only person there, and you hold someone's life in your hands. And you have the skill set and the training to do that, to take care of them and get them where they need to be. And so I want PAs to have that confidence and know that they can change their communities.
I loved what you said there about driving change yourself. Before we wrap up today's episode, is there anything we didn't cover that we should have?
I think the biggest thing is that there's a lot of misconceptions about PAs, what physician associates do, how they should be utilized. There is a lot of misinformation that we are these dependent providers, that we assist, that we ask permission, that we can't do anything without supervision. And that is very, very far from the truth. My entire practice for many, many years, I was the person who saw all the patients in the hospital. I did the clinic on my own. I served often as a first assist in surgery with the surgeons. But I made my own decisions and was able to improve access to care to others who need it. Vascular surgery is a very small specialty. So patients will wait months and months and months to get into a vascular surgery office. And by having PAs that work there with the physicians, patients were able to get in right away before their health or their life or their limb took a turn that we couldn't come back from. So I would say inform yourself. PAs are a trusted healthcare provider. There's lots and lots of evidence on safety and their healthcare outcomes and being really comparable to physicians in the workplace. So, embrace being a PA, own being a PA. Patients should see PAs, and they are a trusted healthcare provider that is untapped. And we have to do a better job of really tapping into this essential workforce in the U.S.
That is a great way to wrap up today's episode with the misconceptions about PA's role and responsibilities. They are essential healthcare providers for us. One of my most favorite providers, actually, that I see on a personal level is a PA. So I deeply appreciate this profession. Dr. Kolb, thank you so much for being with us today.
Well, thank you for having me.
And that does it for this week's Raise the Line podcast. As we've heard today, physician associates are playing an essential and expanding role in meeting the demands of a strained healthcare system. Dr. Kolb helped us understand why aligning policy with practice is critical to supporting that work and what's at stake if progress stalls. Thanks again to Dr. Kolb for joining us, and thank you for listening to Raise the Line. I'm Lindsey Smith. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.